Hi, my name is Brittany Imel, and I am a dual degree MPH MMS student from Arcadia University. The title of my research is Food Security and Medication Adherence in Young and Middle-Aged Adults with Diabetes. So first, to start with a quick background, previous research has indicated that food insecurity is associated with medication non-adherence in individuals with diabetes. This is critical because non-adherence among this population leads to inadequate glycemic control, higher medical costs, and an increase in mortality rates. Prior studies have indicated that food insecurity severity increases as age decreases, which could put this younger population at an increased risk of non-adherence. Limited research on this topic has distinguished between low and very low food security, but one study has indicated that there is a significant difference between low and very low food security. Additionally, past studies examining the association between medication adherence and food security among a younger adult population has been primarily focused on HIV and AIDS diagnoses. However, no known study has focused on the association between food security and medication non-adherence among adults with diabetes under the age of 50. The purpose of this research was therefore to examine the relationship between food security status and medication non-adherence among people with diabetes under the age of 50. The National Health Interview Survey from 2019 was used for this study. The National Health Interview Survey is a national survey that measures a variety of health topics. Medication non-adherence was determined if a participant answered yes to one or more of 4 questions relating to skipping, taking less, delayed filling, or not getting a prescription. Food security was measured in 3 categories. These were food secure, low food security, and very low food security. The data were weighted and the primary analysis was performed using logistic regression to assess the relationship between medication non-adherence and food security status while adjusting for covariates. Figure 1 on the bottom left shows the percentage of medication non-adherence among participants by food security status. Overall, about a quarter or 26% of the participants were non-adherent. The bars are in order from left to right as total observations, food secure, low food security, and very low food security. As indicated by this graph, non-adherence to medication increased as food insecurity severity increased. This trend was observed for total non-adherence and for each individual non-adherence question, as shown from left to right. Table 1 on the top right shows the adjusted odds ratio for medication non-adherence. Bolded and starred lines indicate significant findings. Participants who had very low food security were significantly more likely to be non-adherent than those who were food secure. Additionally, those with low food security were 7.10 times more likely to be non-adherent. It was also found that participants with some college without obtaining a degree were nearly 3 times more likely to be non-adherent than those with at least an associate's degree. Last, Medicaid or other public health insurance was found to have a protective effect against medication non-adherence compared to people who had private insurance. These results indicate that people under the age of 50 with diabetes who have either low or very low food security are at an increased risk of being non-adherent to medication. The findings also confirm that there is a difference between low food secure and very low food security in respect to medication adherence. The higher magnitude of effect found in our current study compared to previous work studying the entire adult population indicates the increased risk for young and middle-aged adults to have to make critical food and medicine trade-offs. Therefore, interventions to improve medication compliance should be targeted at this population. Thank you.